COVID-19 was first reported in Nigeria on the 27th of February 2020 when an Italian national tested positive for the dreaded virus in Lagos and was declared a pandemic by the World Health Organization in March 2019. The virus subsequently spread to other states across the country, while enhanced capacity to contain the virus by state governments were initiated and the federal government increased response through preventive control measures. In January 2020, the World Health Organization listed Nigeria among 13 other African countries identified as high risk for the spread of the virus. To prevent upsurge of the virus, the federal government hit the ground running with non-pharmaceutical and other preventive measures to mitigate the impacts and the eventual setting up of the Presidential Task Force, which was later replaced with the Presidential Steering Committee to, among other functions, coordinate and oversee Nigeria's multi-sectoral intergovernmental efforts to contain the spread and mitigate the impact of COVID-19 in Nigeria, while the scramble for vaccine continued around the globe. Despite different narratives from victims of COVID-19, including deaths from pandemic, there is still this belief that the virus is not real, and the present social distancing observed in the early months of the virus has been jettisoned as people congregate in public places without adhering to safety guidelines. This is constituting a stumbling block to full vaccination of Nigerians, as on the 2nd of March 2021, the first shipment of Oxford AstraZeneca vaccine arrived in Nigeria, and vaccination commenced on 5th March as of 17th May 2021. Over 1 million first dose of COVID-19 vaccine has been administered, and as the third wave hit some parts of the world with devastating impact and in line with containing the risk of upsurge of cases in Nigeria, the Presidential Steering Committee is reinstituting the enforcement of COVID-19 health protection regulations effective from the 12 a.m. 11th May 2021, when the first phase of restriction of movement came into effect. Now the question is, will this phase prevent the spread of the third wave in Nigeria as COVID-19 ravages other parts of the world? Will Nigerians fully comply with the new guidelines? Will there be a new attitudinal change concerning vaccines and vaccination? Well, this is the thrust of conversation tonight on COVID-19 and the third wave on Tuesday Live tonight. I am Omini Odan. Before then, let's take a quick listen to this background put together by Mitara Ekmen.
It's more than a year of coping with the COVID-19 pandemic and the guidelines that come with it. But fatigue is setting in for the citizenry, and disregard for the protocols is glaring and widespread.
So many people are uneducated about the mask. They just feel they wait for the police, they wait for the NCDC, personnel, not for safety, because they are not well educated about it. So I don't feel safe at all not wearing the mask.
We are feeling so relaxed right now. We think it has actually died, but it is not yet dead. It is still real.
Let's not be deceived. There will be a third wave. If what is happening in other jurisdictions is anything to go by, COVID-19 is not likely to go away very, very soon as we expect it to.
That is certainly what many Nigerians dread and don't want to hear. But for the managers of the pandemic in the country, the surge and virulence of COVID-19 variants in countries like India, Brazil, and Turkey means that no one is safe until everyone is safe. The Presidential Steering Committee on COVID-19 has since issued a travel advisory restricting travelers coming into Nigeria from those countries. It has also reintroduced restrictions on the populace as community spread of COVID-19 is not unlikely, despite the low positivity rate at the moment.
It's a welcome decision from the authority, and at least we've experienced it before. It's not the first time. At least we will adhere to it.
The PSC plans to vaccinate 70% of Nigerians by 2022 towards achieving herd immunity against COVID-19. But vaccine hesitancy is still a challenge.
Very prominent members of society, unfortunately, really contradicting the efforts, the very difficult efforts, very sustained efforts we've made to raise vaccine acceptance in the country.
So we must resolve as a people to ensure that whatever steps we take going forward is to build on the successes that we have recorded and get ourselves prepared for any eventuality.
Currently, almost 2 million Nigerians have received their first dose of the Oxford AstraZeneca vaccine. But the global scarcity of vaccines, which is worsened by India's decision to retain vaccines for its own population, leaves the PSC with the option of enforcing COVID-19 restrictions and protocols to mitigate community spread in the interim. The Presidential Steering Committee on COVID-19 has emphasized that the COVID-19 restrictions and protocols are not punitive, but have been put in place to safeguard public health as well as ensure a balance between saving lives and livelihoods. In Abuja, Mitaire Ikben, NTA News.
Addressing COVID-19 resurgence in Nigeria is the focus of the program tonight, and Mitaire's report sets a tone for the take-off of the program, and it's Tuesday Live at some point. In the course of the program, our phone lines will be displayed on the screen. If I true to you, please turn down the volume of your set and go straight to the point. Ask your questions, and our team of panelists will be here to address them. Also, you can join the conversation tonight through our Twitter handle at Tuesday Live NTA. We have a couple of reports that will be dotting the landscape of the country, and today we shall be going to Lagos, Enugu, Bauchi, Delta, Jos, and Edo on the second part of reports tonight. Tonight, I'm being joined in Abuja and via Zoom for the program, a team of panelists, beginning with Dr. Mukhtar Mohammed, Technical Head, Presidential Steering Committee on COVID-19 and National Incident Manager. Welcome to Tuesday Live.
Thank you for having me.
Dr. Chinwe Ochu, Director, Prevention, Program Knowledge Management, Nigerian Center for Disease Control, NCDC. Good to see you once again on the program.
My pleasure being here again. Thank you.
Joining us via Zoom, I hear Dr. John Tor Agbide. Dr. John Tor Agbide joined us via Zoom in New Jersey, United States of America. He is a neurotoxicologist and founder, CEO, in-country Medicare. He practices well-being, personalized and precision medicine, Secretary General, Integrative Medicine West Africa, member of the Committee of Experts on Complementary and Alternative Medicines, Federal Ministry of Health. Welcome to the program, Dr. Agbide.
It's my
So tonight, joining us via Zoom in Maryland, United States of America, is Dr. Simon Agwale, President, CEO, Innovative Biotech Nigeria, United States of America Chair, Africa COVID-19 Vaccine Manufacturing Initiative Chair, Vaccine Production Subgroup, ECOWAS, WHO Expert Committee on Access and Local Production of COVID-19 and other vaccines in West Africa. Welcome to the program once again. We are also expecting the CEO of National Primary Healthcare Development Agency. If he's here, we'll introduce him accordingly. Gentlemen and lady, let's begin. Dr. Mukhtar, let's begin with you. Let me just say, where are we right now?
Well, 1 full year into the pandemic in the country. We have seen varied successes, and we've also seen some challenges in our response. But let me say that at this very critical point, it is critical in the sense that the epidemic has kind of stabilized in Nigeria, but there is the threat and the risk of importation of additional cases with the new variants that are developing, and therefore we have to sit tight and also improve our surveillance system, sharpen it, and make sure that, particularly at our entry points, that we observe the protocol and that people who are coming into the country are properly screened. It is critical for Nigeria in the sense that we know that India was in this situation exactly about 2 months ago. They were at the point where the epidemic has so stabilized that they were about to write off the epidemic. People have lowered their guards, as you saw in the report by Mitari. People are no longer using face masks, no temperature checks in public places, and there are so many public gatherings. In Nigeria, you will agree that we had so many religious gatherings, we've had so many political gatherings, and very recently also, we have celebrations in as many cities as possible, despite the caution of the Presidential Steering Committee. So it is really a critical point in the sense that if we have new strains or anything changes in the epidemic, we start seeing rising number of cases, then we have to prepare and brace up, to face the third wave of COVID-19 pandemic.
Well, I'm surprised to hear you say importation of cases into the country. Across platforms, almost everywhere, all kinds of messages and what have you. What would have been responsible for this?
So the reality is that we can only reduce the risk. We can mitigate the risk, but we cannot eliminate the risk completely. So despite the measures that we are putting in place, you realize that some people actually escape. For example, our regulation requires that if you come into the country, you go and do a mandatory 7-day home isolation. It is not that we are not aware. We know that many people don't observe that. And we know that some people also even escape doing the 7-day testing, even though we have announced suspension of passports. So these are the ways in which cases come into the country. At the point of entry, they can be negative, but because they are in the convalescent stage, after some few days, they can turn out to be positive, and then they'll continue to infect the public. So it's not only the importation of cases, but even the cases within the country. As we lower our guards, more people continue to interact freely and also do not use the public health containment measures. So that encourages, the spread of the infection among the population. And also, mind you, that the variants we are talking about are also going mutation, even here in Nigeria. So it continues to develop and change its forms. And when it gets into that virulent stage, then you have a very huge spike in the number of cases we are having.
Okay. When the loud noise came up regarding the Indian variant, it looks as though the cases in Nigeria dropped drastically. I think by the last count yesterday, it was less than 70, about that something, right? By yesterday, right? Well, by today. Okay. Now, the question we ask is it because the cases are dropping and we still have cases where people are in disbelief? Why should people still be in disbelief?
I think that's a very natural reaction. When you see the numbers dropping, the tendency is for people to believe, we're out of crisis. And most people, they step down on their guards and begin to do those things that will predispose them to risks. So there is a variant which unfortunately people have labeled as Indian variant. We shouldn't really stigmatize any nation by labeling a virus after that nation. But the virus has been detected in the country, though not many cases have been detected. What we do at the Nigeria Center for Disease Control is to carry out regular risk assessment. Dr. Mukhtar talked about risk. It's all about the risk of that virus spreading in the country. COVID-19 is an infectious, highly infectious disease, but thankfully we know how it is spread. We know the mode of transmission is a respiratory infection that is spread by respiratory droplets and also through contact. So having this understanding means we know the answer, how we can protect ourselves and keep ourselves safe, how we can be prevented. So once the virus, we detected the strain in the country, then what NCDC did and the Presidential Steering Committee was to assess the risk of spread of that strain in the country, and then to also look at the trend in other countries that have recorded that variant. And that was why the government proactively decided to reinstitute those preventive measures, those regulations that are meant to keep Nigerians safe.
Okay, we'll come to the preventive measures. Let me quickly ask, is it true that NCDC just allocate numbers on a daily basis?
Well,
that's some of the things on the streets.
Yes, I understand. The simple answer is no. NCDC works with data, and these data coming from the various states of the Federation on a daily basis. We have what we call the SOMAS, which is a data reporting tool that enables real-time reporting of cases. And this SOMAS, prior to COVID-19 outbreak, was just deployed to over 21 states of the country. But currently we have SOMAS deployed in 774 local governments of the country, meaning that our disease surveillance and notification officers have this app with them, this digital tool with them to report the cases as they detect them. In the health facilities, they are able to report and notify as the cases come. And as they are reporting through SOMAS, they are imputing it into SOMAS. NCDC is seeing the numbers as they rise or drop on a digital platform, a dashboard that is not only at NCDC, but also in all the states. So we work with these data as they come in. They may not be, exhaustive, but that is what we get. And as we get them, we report them. We've tried as much as possible to be very, very transparent. Since the outset of this outbreak, we have been very, very transparent, reporting the numbers as they come. So what we see, and mind you, only, it's not just that the numbers are dropping. We don't just look at the numbers dropping. We look at what we call test positivity rate, which is even more important because it depends on how many you are testing and how many out of those numbers tested turn out positive. So thankfully, again, the test positivity rate in the country has dropped drastically. And currently we have about or less than 1% test positivity rate. So that means that we are actually making progress. We are winning the war, but the battle is not over. And we need to sustain this gain. That is why we are learning by observation and not by experience. We don't want a third wave to come before we start implementing all these preventive protocols and reminding people that the virus is still very much around. The fact that the numbers are dropping doesn't mean that the virus has left. And look at what happened in India. The numbers actually started dropping, and everybody, they started behaving, all those things that they had stopped doing before, all those super spreader events, like religious festivals, political rallies, everything started happening, and the numbers started rising again. And the virus mutated, and now they have a terrible virus to deal with. We don't want a similar experience in Nigeria, because we also know our limitations as a country. So it's better that we prevent it than we wait for the third wave to come upon us before we start reinstituting these preventive protocols.
Okay, let me hold you there. I'll still come to you. You have a lot to give us tonight from NCDC. Let's go to Dr. Simon Agwale. He's joining us via Zoom in Maryland, United States. Doctor, you are in the United States of America, and if listening to Dr. Chu speak the way she speaks, coming to the studio tonight, I saw through a video coming from the United States, and we still have a bunch of people who still believe that this whole thing is lies, and they send these videos down to Africa, down to Nigeria, trying to make people still be in disbelief. What is your perspective from this direction?
I think it's unfortunate. I mean, the NCDC guy spoke very well. Dr. Mutak spoke very well. So the reality is that if you don't take the vaccine, or if you have not been infected, you are at risk. If you look at the impact of vaccination as far as COVID is concerned, Israel decided to vaccinate all the adults. Now they are working on vaccinating kids. And they've opened up their businesses. They're going back to work, except for the crisis that is going on there. Here in the state of Maryland, and of course US, as you know, 2/3 of the adult population have been vaccinated. The children are going to, some children have been vaccinated already, and then more kids are going to be vaccinated. And then the infection is dropping drastically. In the state of Maryland, transmission has dropped by 74% because of vaccination. So, it is funny for, this is data. Science is all about data. It's not about opinion or something. So this is the data that we have. So vaccines do work. We know that vaccines work. There's nobody on earth that has not, one way or the other, benefited from vaccination. Smallpox was eradicated because of vaccines. Now polio, as you know, so far has been eradicated because of vaccines. Measles eradicated because of vaccines. And this is an intervention that has been going on for decades. It's nothing new that is happening today that has not happened in the past. Now, if you come to COVID, for example, I can understand people's concern that the leading products, the mRNA vaccines, the viral vector vaccines, have not been used in the past. These are technologies that have been in development for decades. That's nothing new. If you are developing a product, all the safeguards are considered, including the animal testing, you do the human clinical trials. There are all kinds of oversights, including the participants that are participating in clinical trials. They can withdraw at any time if they choose to. So there's nothing new about what we are doing. If you don't want to take COVID vaccine, it's like saying, I don't want to take Panadol. What's the difference? What's the difference? You have HIV patients that wake up every day and they take pills. Before now that we have one pill that they swallow, they take 30 pills on a daily basis, reduced to 20 pills and 10 pills. Now you have one pill. If those guys tell you the side effects that they go through for taking those pills, so you have to weigh the benefits and I've taken Moderna vaccines. I just took my second dose a few days ago. My entire family have taken their vaccines. There's no any reaction apart from the pain on the side of injection, which is normal. So the issue of saying, all kinds of conspiracy theories and all of that is bullshit. Let's look at the data. The data here in the US is that the old people infection rate has dropped by 85%. That's the data because of vaccination. Economy has been open. People are going back to work. In fact, I just came back from the store now. of course, you have people that still wear their masks, but 50% of the people were wearing they were wearing their masks, and 50% were not wearing their masks because of what? Because of the effectiveness of the vaccines that we have. So if you get people vaccinated or people that contract the infection and recover, you end the epidemic. That's how to end an epidemic.
Dr. Agwale, let's go to Dr. John Toagbide. And Dr. John Toagbide, I'll be asking you this very straight question. What action needs to be taken? I ask you this because listening to you severally, you have always talked on building body immunity with the natural immunities in place. How best can we handle this side-by-side vaccination?
Thank you very much, Omini, for that question. I think before I go on, but let me also share my personal experience since I came over back to the States. I had to also take, the Moderna, vaccine. And my experience was very, rather exciting. In the sense that when I took the vaccine, I was expecting all sorts of reactions that people have actually attributed to the vaccines. At least, I'm gonna tell you one thing: even pain, I did not experience. Up to the point where I was joking with my daughter, saying that, hey, is it that maybe they just gave me a placebo? But when I lay down to think about it, you see, as a practitioner of integrative medicine, and I got to do what I say, I've loaded myself with antioxidants and immune boosters, and so what? So you can simply explain why I did not react to the vaccine in that way is that my immune system was already upregulated. It is the result of the vaccine trying to wake up the immune system that you experience some of these side effects like pains and then fibromyalgia and then others. But here is John Doe, who was already immunologically boosted. So when he got the vaccine, I never experienced anything. In fact, that night I had one of my best, sleeps. So what I'm also saying, just like Dr. Agwale alluded to the fact that is that vaccines are actually good. However, in our present situation, even naturally, I always emphasize on the need to boost our natural immune system. Immunity is in three arms. You have the innate immune system, you have the adaptive arm of the immune system, which is subdivided into two, the humoral component, which is antibody mediated for the production of antibodies. Then you have what you call the cytotoxic T cells. So these three arms, if they are boosted, naturally it goes a long way. So let's talk about natural immunity. To the best of my understanding, you see, natural immunity, the way it comes about, it is actually non-specific, especially the innate arm of the immune system that you try to build up. So the innate, it is the humoral arm of the immune system that is actually cell-mediated, that it is known as, trained immunity. Because when that humoral arm of the immune system respond with the B cells, what you call the memory B cells, they now memorize, into their own context, that once the antigen, that is the virus, comes in, then they can just rise up and attack it, immediately. This way you don't go down the line of developing the most severe form of the disease. But back to natural immunity, when you have natural immunity, which is actually not specific, and as I've also shared with you, giving my own experience, when I had the vaccine, the reaction was not overboard.
I slept soundly. There was no temperature, no high temperature. If I were not aware, if it were not for my own knowledge and understanding, I would have even questioned that, oh, is this really the vaccine? But so take this, that building the natural immune system would go a long way in complementing the benefit of the vaccines. Worst case scenario, if you don't even have the vaccines, and your natural immune system is well boosted, and we have discussed there are several ways of immunomodulating or building our natural immune system. We'll talk about diet, we'll talk about lifestyle in general, then you talk about good sleep, you talk about exercise, and then some of these are natural foods. They are really very good. At this point, let me really compliment one of my colleagues, pharmacist Zainab, who is the departmental head of traditional, complementary, and alternative medicine at the Ministry of Health. That one has just released 3 volumes of her books. I will urge each and every one of you to have access to that, because those who have been calling on, you've been talking about vitamin D, you've been talking about vitamin C, these are natural supplements, they are costly, we cannot afford them. She has gone into details of listing several of our traditional herbs and products that people can use. However, there is a caveat here. In times of overwhelmed immune compromisation, as we have in a pandemic like this, there is need for those supplements. You have to combine them, and even when you can even go higher, some of these supplements you have them in injectable forms. You have vitamin D, you have vitamin C, all in injectable form. So let's not just look at one way. Let's complement and bring together the different aspects, looking at ways of enhancing our natural immune system. You can use natural products, you can use supplements, you can even use injectable. Then you are then the third step towards attaining herd immunity is the vaccination, which in the course of this discussion we will try to convince you that vaccination is no harm. It has no harm. You should go for it. Vaccination is one way of attaining herd immunity. Talking about the United States, let me just cap there. Recently they just slowed down the use of masks, just like Dr. Gwale said. Just in Maryland here, even in New Jersey now, the guys can go on. Why are they able to do this? It's because of the number of people that have been vaccinated is close to attaining herd immunity. In fact, if you want to know, just like it said, 60% of the adult population in the United States have at least received the first dose of the vaccine. They're waiting for the second. Back in Israel has attained herd immunity by vaccinating over 60 to 70% of their population. Britain is also opening up its own economy because it has also attained that effective level of vaccination of at least 60 to 70%, and by implication have attained herd immunity. They are opening up their own economy. So in summary, let's not rest on our own laurels. I'm glad in the opening statement we were told that Nigeria has not attained that. So in that case, we must not rest on our own laurels. We should continue the implementation and enforcement of the non-pharmaceutical interventions, like use of masks, washing of hands, practicing social distance. Because if you think, well, we're very good at, copying, we say, after all, United States have stopped, the use, public use of, masks to a certain extent, same thing with the UK, because these people have attained herd immunity. We haven't attained immunity. So we should not make the mistake of thinking we would go back. Instead, it should be enforced more. If you look at the population of Nigeria, about 200 million people, we got only about 2 million, doses effectively. So you see, two over 200 gives you what? Only those of you who are good mathematicians can tell me the percentage. Even with what we have, there is a color here. We don't know when the next one is up, but I'm sure the government is doing everything possible to get in more vaccines. So when vaccines come in, people should get vaccinated. Meanwhile, let's continue to pursue natural ways of building or immunomodulating our systems.
Thank you so much, Dr. John Twagbide, for your opening thoughts. And I said earlier that we were expecting the CEO of the National Primary Healthcare Development Agency. He would have taken some questions, but I'm constrained to take the questions to Dr. Mukhtar right here, because you are the National Incident Manager, but he is on the field on vaccination. So we need to take stock or interrogate the issues of vaccination in the country. Now, a number of persons are yet to be vaccinated, going by the updates we get from NCDC on a daily basis, or the National Primary Healthcare Development Agency. Yet, some are almost due. In a couple of days or weeks, some persons are due for their second dose. Some have taken their first dose, some have not taken their first dose. What is the interplay? First dose, those who have already taken, those who have taken, what arrangements are in place to begin administering the second dose?
So actually the big question is really our vaccine coverage in the country. We had a plan, and our plan is to vaccinate at least 70% of the population by end of 2022. For now, what is happening is we got the first batch of the vaccines, which is just about 4 million doses. And we were expecting additional doses of the same Oxford AstraZeneca and even other vaccines into the country. But because of the global vaccine shortage and the vaccine politics, that is going on, the vaccine nationalism by the rich and developed countries, amassing all the vaccines to themselves, it has created this scarcity, and it has ruined all the plan, that has been made to support developing, countries, to be able to get their fair share of the vaccine. Now, that is not just, that is not fair, that is not equitable, and it is really causing a very great imbalance in terms of the vaccination drive in the whole world. Remember, when we are dealing with pandemic, when one part of the world is not safe, no other part of the world is still safe. So the fact that you have vaccinated your people doesn't mean that you are completely immune against having this disease, if still COVID-19 continued to ravage other populations in the world. It really calls for a global concern. It calls for really some reasoning to see how these vaccines can be distributed. But that is also to recognize the fact that there is global demand. With India trying to deal with the situation they have in their homeland, trying to vaccinate as many people as they can, they will not be, in a position to start exporting these vaccines, to other nations, which is basically reneging on the agreement that have been signed with these companies to do it. So what we need is really to boost vaccine production all over the world. There is no point in limiting the technology or keeping the propriety, rights, to certain countries or to certain companies, but to see how all this can now be liberalized and decentralized so that other countries can now begin to manufacture these vaccines so that there will be more equitable distribution. Now back to Nigeria. The number of people who have vaccinated is really not much. It's a drop in the ocean. Just like he mentioned, 2 out of 2 million, that's just 1%, of Nigeria's population. That is a far cry from where we intend to go. And regarding the second dose, and that we are lucky that we have already taken this initiative, that we reserved the initial doses, which was really a plan that came up later. Initially, we were to vaccinate different people with all the 4 million would have gone in first doses. But immediately we started seeing signs of this global scarcity. The plan was quickly reviewed, and we came to conclusion that it is better, we reserve these vaccines for people who have received their first dose so that we provide them with the second dose within the timely limit of, when this vaccine will not be effective. Mind you, also, we are also dealing with the expiry dates of some of these vaccines. So it was really a strategic move that, looking back now, we will say that, yes, we have made the best decision to make sure that we have reserved the doses for people to receive their second doses.
So we are sure that by the time the second dose begins, has it begun already, or we are...
The second dose vaccination has commenced, and some people are, because we are looking at the period of 8 to 12 weeks. So for some people, we have shortened it to take the second dose between week 8 and week 12. But really it has started, and people will continue to take their second dose. And there is enough doses for all those who have received their first doses. There is no need to panic. People will get their second doses. And before I leave you, let me also give part of the efforts that we are making as a country.
So we will leave you to go. You will not leave us to go.
So there are really concerted efforts, to make sure that we secure a fair share, of the doses of either Oxford AstraZeneca or Johnson & Johnson that has recently been approved for use by WHO. And there are bilateral discussions also going on with different countries. With Sinovac, China, it has also received WHO pre-qualification, and we also have the Russian vaccine. So all these discussions are going on, and also the need to have a manufacturing plant in Africa that can help make these vaccines more available, readily available to other African nations.
Still with you, Dr. Buta. Well, we still hope that maybe Dr. Faisal will be here with us tonight. Now, discussing the second wave in Nigeria, I remember we asked Professor Nasidi here on the vaccine politics. He said clearly, the developed nations would not release one dose to a developing country when their own population has not gotten it. By this time, Israel was ahead, and as we speak, Israel has attained herd immunity already. Now, next phase, we had a professor from the Nigerian Institute of Medical Research with us here. And in that program, discussing one of the segments of COVID-19, he challenged Dr. Agwale, who is joining us from Maryland tonight, and said, what are they doing out there? Why can't they come to the country and join forces towards thinking towards Nigeria, going towards manufacturing vaccine, than maybe you tell us here, importing vaccination? Well, some of the best brains that are involved in the manufacturing of vaccines in other climes are Nigerians, are Africans. What is the Presidential Steering Committee working towards the direction to ensure that Nigeria begins the manufacturing of vaccines?
So let me just take a step backwards. We all know in the 70s, Nigeria was actually producing yellow fever vaccine in the National Institute of Medical Research in Lagos. And even currently, we know that Nigeria is also producing some of the vaccines used in the animal veterinary medicine in the country. And the technology is not very different. However, there are certain measures that need to be in place, some safeguards. There are certain protocols that have to be complied with. But most importantly, in this particular instance, it is mostly the issue of, the proprietary access and the rest, because the vaccines are already known. The manufacturers have invested their money. They are trying to recoup their money and maybe make a little profit. But this is a humanitarian case. And therefore, all these issues need to be waived. There are strong pressure from the international community, the United Nations, the Vaccine Alliance and others to try to push these manufacturing companies into allowing, giving up their proprietary rights and allowing the production of these vaccines in other climes. So that is going on. On the second hand, yes, the developed countries will not release, a dose of vaccine if they are not sure that they have enough for their population. But there is no justification. There is no justification for any country to keep vaccines 5 times more than the number of their population. They are not going to use those vaccines at all. And these vaccines have short expiry period. They are going to expire on them. They use a lot of money to procure them. And perhaps maybe at the point they will be donating these vaccines to developing countries, it may be too late, because the developing countries may not have the logistic systems necessary, to utilize those vaccines within the short period of time that they are giving this. So it is really a clarion call, a global call, for us to see and understand this pandemic from the other side. It is not money now. It's not money that is going to procure your vaccine. It is the goodwill of the manufacturing company. It is the goodwill of the countries that have already amassed these vaccines, that have orders in the pipeline, which the companies are obliged to, to produce for them. In Nigeria, yes, we do have seasoned scientists, people who have worked. We've had several meetings this week regarding the vaccine production in Nigeria, the vaccine initiative, and what we need to do. And
are we hopeful?
We are quite hopeful. we are quite hopeful, but vaccine production cannot be done in a day or in a short term. What we are looking at, our vision is to lay the foundation so that in the next 2 years, 3 years, or 4 years, we should have key deliverables and key milestones that we have achieved towards sustainable production of vaccines in the country. We are also in direct consultation with other countries who are willing to help Nigeria to be able to negotiate or to broker between Nigeria and these manufacturing companies, so that we can have these rights given to our leading companies, that will be able to take this manufacturing forward. So I do not want to preempt this, but the discussion is brewing. It is really going on. I am glad that we have Dr. Simon Agwali, who is a very good friend of mine, and we have worked together in the past, and we know that we need people who are resourced in this vaccine engineering and vaccine technology to be able to provide their support. And I know they are willing, to come back and see what they can do for their homeland.
Okay. Dr. Chinwe, before we go into that, I want to be very specific. If, like he said, if the entire world is not working hand in sync, then the issue of variant will continue. The spread will continue. And back in Nigeria, what is the position with Kogi State? Are they still cooperating with NCDC? If they are not cooperating with NCDC, is it possible that the variant will take off from there? What's the update?
We've been working closely with the states in our response to this pandemic, just as we've been working with them in our response to all the other disease outbreaks. And a lot depends on state ownership of these public health interventions. What NCDC does is to coordinate the response and to build capacity. And we have prioritized that subnational capacity building, so that what we have at the national level, we're able to have similar capacity at the state level, because that is actually where these outbreaks start. And that is where you have people that really interface with the grassroots and know where these problems are coming from. So state ownership is key in the containment of any outbreak, or even in the mitigation of its impact. So this is what we have been doing, not just with Kogi State, but with all the states of the Federation. Of course, different states are at different levels of taking ownership of their own public health intervention. Talking about the strains, in the country currently is only 2 states that through our minimum capacity in genomic sequencing, we've been able to detect the strains in just 2 states in the country, Edo and Osun. So what the most important thing now is to ensure that wherever these strains are, they don't spread. And that is why we keep coming back to these non-pharmaceutical interventions. We can't run away from them. Even though we are moving, it's actually a 2-pronged approach. We're trying to prevent the transmission, while on the other hand, we are vaccinating people.
But you're not hitting the nail on the head. What is the position of Kogi State currently regarding national containment and response to COVID-19?
Kogi...
NCDC covers Nigeria. And you just told us that you have now spread 774 local government areas in the country, meaning local government councils in Kogi State are part of it. So what's the update regarding Kogi? Because let's be very, very practical here. During Ebola, President Obama set up a team and sent to West Africa. He said, if we don't wake up and stop it right where it's happening, it will spread. Now, if the variant is coming on, we're not checking a particular state in Nigeria. It's very emphatic no about COVID-19. NCDC, Nigeria Center for Disease Control, are you saying that you don't have what it takes to insist and ensure that this state gets involved?
I mean, NCDC is not an enforcement agency.
Okay.
What we do is to keep, engaging with the states.
At the detriment of the people's health?
It's not at the detriment of the people's health. What I'm trying to say is that each state has a responsibility to keeping his own people safe. And in the country, health is in the concurrent race.
Absolutely.
Yes. So the state is squarely responsible for taking those preventive measures for its own people. So what we do is to encourage states and to keep engaging. And we've seen a lot of progress, even with Kogi State. Where we are now with Kogi State was not where we were last year, definitely.
Okay.
So there is progress. We may not be where we want to be, but we are making progress. And we continue to engage and provide all the support that is needed. If there is an outbreak in Kogi State, NCDC sends rapid response team to the state. So there is it's not a matter of like I said, we are not an enforcement agency, we are not security, we don't police anybody, but we present the facts and give you the data and empower you to be able to do what you need to do to keep your people safe. Okay. So what you do with that, those information is clearly, that is, your people should take you, hold you responsible for the way you handle the information and the data that you get from NCDC. What really matters is to focus on the gains so far. There are a lot of states that have actually been cooperating and doing a lot. We have noticed a lot of improvement in the way states take ownership of their own health security. Before now, we didn't have isolation and treatment centers in many states of the country. But there is no state in this country now that does not have an isolation or treatment center. Okay. We didn't have molecular testing capacity in laboratories in many states. At the outset, we had just 2 or 3 molecular labs that could diagnose COVID-19. But now we have in all the states of the federal, we have over 100 molecular labs, including private labs, that can test for COVID-19. So these are the gains that we can, focus on and then try to sustain it, try to consolidate on those gains. This is why we are also saying, I think we have a lot of opportunities that this outbreak has thrown on us as a country.
Okay. Well, the good thing is that why I keep interrogating this is, one, we are a people.
Yeah.
While India today is talking about 1.44 billion, Nigeria is talking about 200 million plus. And if we don't take issues of our health seriously, Nigerians traverse. We all crisscross all over the place. And from the issue of just simple social distancing is one of the precautions to take against the spread of COVID-19. So if I'm happy for you to say that, yes, where you were with Kogi is not where you are right now. So meaning that we're heading somewhere, because if we don't nip it here, it could spread from here. And the next spread could be worse. Anyway, the focus once again is...
Can I come in here? So
yes,
very quickly.
Yes.
Because our slogan has been take responsibility.
Okay.
For this outbreak. And it has helped us a lot. And we are using this same slogan and this same approach for all the other infectious diseases. What we should be asking ourselves now is not to be pointing fingers at people and saying what they are not doing that they ought to be doing. But what is it that I'm supposed to do that I'm not doing? Okay. Because even people in Kogi State, they are watching us now. They listen to us. They have access to all this information that are laid out there. They know about physical distancing. People in other states also have access to all this. But we are now the ones. You don't need the government to come and tell you to wear your mask. You can wear your face mask by yourself. You don't need your government to tell you to wash your hands with soap and water. You can do that by yourself. Do what you ought to do and what you can do. And then let's watch the other person play his or her own part. Okay. It is this collective responsibility that will help us to win this battle.
Thank you so much, Dr. Chinwe. Well, taking responsibility has been the watchword all along to the advocacy on COVID-19. Now, when we return, do vaccines or do some of the vaccines contain magnetic materials? When we come back, we'll be beginning with Dr. Agwale. But before then, let's begin taking some of our reports already as we speak. Our Twitter handle is bursting with all kinds of inquiries, interrogations, and what have you. But just after this time out, stay with us.
After more than 1 year of relentless strategies, synergies, restrictions, and positive results, Nigerians have adapted to life in a pandemic world. With growing coverage of COVID-19 vaccine across the country, business and religious activities as well as learning kicked off, but with strict measures to prevent further spread of the virus. However, in the last few weeks, mostly due to laxity, fueled by a false sense of security against getting infected, majority of Nigerians have thrown caution to the wind.
Not that I don't usually have a face mask, but the thing is, because all the sanitation has reduced, so I don't know where I feel like everything is fine.
Well, the airwaves are charged with news of new strains of the COVID-19 virus ravishing nations and a third wave lurking around.
This is not the time to be anxious, but it is time for us to keep to all the protocols of COVID-19 prevention that have been rolled out by the experts so that we don't have a third wave. It is time for us to be very careful.
Just like the Presidential Steering Committee on COVID-19, Lagos State is determined to rescue the nation from the impact of a third wave of the virus. The state is intensifying campaigns and education on safety measures, ramping up testing to detect mutations, and enforcing compliance with non-pharmaceutical interventions.
We are not resting. We are preparing and building resilience, first of all, to ensure that we make it very difficult for a mutant or new strain virus to enter Lagos. But if it should, that we stop it in its tracks and we stop it from being transmitted into community and causing community transmission.
Apart from the countries placed on the red list by the Presidential Steering Committee, Lagos is also closely monitoring developments and travelers from several other countries, including the United States, Kenya, South Africa, Ghana, and Togo, to prevent importation of deadly new strains.
The key thing with epicurves and where we are as a country is the fact, and if you are learning from other people, is the fact that until you eliminate the concept of vulnerability and the chain of transmission of disease, the next wave is always looking around the corner.
For those waiting in line to take the shot, Lagos State has taken delivery of another batch of 57,000 doses of the AstraZeneca vaccine from the federal government. So far, only less than 1% of the population has received the vaccine.
The report from Lagos takes us to the next from Enugu State.
In some schools, markets, parks, and other public places visited, people were seen moving about without fully observing the COVID-19 guidelines by the Presidential Steering Committee. The level of compliance as regard to COVID-19 vaccine administration is also low, despite the measures put in place to curtail the spread of the virus. The reason Enugu State Government Task Force on COVID-19 recently visited public places like markets, parks, multinational companies, among others, to sensitize the citizens on the need to adhere to all COVID-19 safety guidelines in anticipation of the third wave of the pandemic.
We also tell them how to assess the vaccine, the availability of the vaccines, where they can get the COVID vaccine. Now it is available, and we want to call on all residents to avail themselves of this vaccine.
Community and religious leaders in the state are equally calling for the adherence of the safety guidelines.
Of course, it's all about our lives, and I have encouraged my subjects, likewise all the traditional rulers in Enugu State, to make sure that they have the COVID-19 protocol, because it's all about saving no other person than yourself, and they are all keeping to that.
Going through the COVID-19 protocols are for our own advantage, for our own good, for our own health. We need to be alive to worship God. We need to be alive to pursue your economic endeavors. Those information are very important for us, and we need to follow them up to have a healthy life.
The teachers maintain those protocols, spaced out in the staff room, have their face masks on, and have a regular hand wash.
The last on this segment is coming from Bauchi.
Since the onset of the COVID-19 vaccination on the 5th of March 2021 in Bauchi State, 47,290 people have been vaccinated, and there are 55,090 vaccines at hand, while people have commenced receiving their second dose of the vaccine. The chairman, Bauchi State Primary Healthcare Development Agency, Dr. Ruwan Mohammed, said the exercise is recording hesitancy in some communities.
The guideline is very easy for us to follow in Bauchi State. I actually asked my people to look at if we have any club in Bauchi. We have only one in the whole Bauchi State. And that they don't even the clubs, I'm sure because of the COVID-19, they don't even do anything again for now because of the COVID-19. We put a measure that they should stop for now because of the new guideline.
He, however, said people should not let their guard down, but continue observing the new presidential guidelines for COVID-19. Dr. Ruwan Mohammed also assured that the vaccine is safe.
Well, we'll still sustain the conversation after this break.
The vaccine offers hope for a safe country free of coronavirus. I urge all state governments, traditional and religious leaders to take the lead in the mobilization effort within their environment and spheres of influence. I similarly urge all eligible Nigerians to present themselves and be vaccinated in accordance with the order of priority already mapped out at the various authorized designated centers only.
These days, people get their news and information from more media sources than ever before. Some of the news and information given are fake, unverified, doctored, and manufactured to create confusion, stir disaffection, and cause disunity. Before you believe or share any news, ask yourself, is this real? Is it from a credible source? Is it verified or verifiable? Fake news is dangerous. Whether you do it for fun or for political gains, real people can get hurt. Fake news, don't create it, don't spread it.
This is a public service announcement from NTA.
You can follow us on all our social media platforms: Facebook at NTA Network News, Instagram at NTA Network, Twitter at NTA News Now, YouTube at NTA News Online, or visit www.nta.ng. For live streaming, visit www.nta.ng/live. Now, you can stay updated on the go, be it on your TV, iPhone, laptop, or iPad. or download the NTA mobile application from your Play Store or App Store. NTA, you can beat the rich.
Tuesday Live, a network issue-oriented innovation talk show.
Thanks for staying tuned, and we go straight to Dr. Simon Agwale. Doctor, beginning from this segment, let me start with the myth around COVID-19 and COVID-19 vaccination. What explanations will you offer regarding this myth that if you take the vaccine, in a couple of years you die? And some of the vaccines, it's alleged, have magnetic materials. How do you handle this?
Thank you very much for that excellent question. First of all, before I answer that question, let's look at the facts. There's no way that you can end any epidemic without a vaccine. It's clear. Measles, smallpox, polio. We're talking about eradication today because of vaccines. And there's no way you can end this epidemic without a vaccine. So the truth of the matter is, let's look at how the question should be how we can get these vaccines to people. That's my concern right now. It's not about whether the vaccine has chemical or it has this, it has that. That's not the issue. I will address that. But today, Tuesday, the CEO of Serum Institute of India announced that before they start exporting vaccines again, it will have to be towards the end of this year. So automatically, Nigeria should not expect to have any vaccine until the end of the year, because the COVAX program is specifically focusing on that particular product. The next product, which is the Johnson & Johnson vaccine, for example, which Nigeria is also expecting from the African Union, they have huge problem with the manufacturing site here in Baltimore, which is just about 15 minutes drive from where I am, that the supplies have dried up. So the thought is that if we are looking at Pfizer vaccine already, the European Union has purchased 1.8 billion doses from now up to 2023. And then if we look at Moderna, the US government is now vaccinating children, and there is the possibility that the third dose is going to be given by the end of the year. Where are you going to get the vaccine from? This is what is paining me, that we go around and talking about issues that don't really matter. The key question, the issue that we need to address as a nation is, how can we make these vaccines? If we can't address that, we're sitting down here and wasting our time. How can we make it happen? Now, as a concerned Nigerian that God has blessed to be involved in this global issue, nothing is done in Nigeria and in Africa. So what have we done? So what I have done is to be involved So everybody, including Dr. Mutai, all this, everybody knows that the past 10.
Agwale, your audio is getting very, very bad. If it improves, we'll come back to you and you complete your line of thought, please. Let's go to Dr. John Twagbide, and I'll begin with him regarding the tweets. Tweets have started coming in, and there are a couple that I'll take to Dr. Mukhtar here, but the very first one I'll take is the one that talks about body immunity, and I take that to Dr. John Twagbide. Dr. John Twagbide, if you're listening, this particular one is coming from Nadob Wiyep at 77. Okay, I hear Dr. Twagbide is not up. Let's begin a couple of the tweets, Dr. Mukhtar. About 3-4 tweets are almost around the same issue, and I want to take them to you now. First is at Idris. It says, what are COVID-19 variants and test positivity rates? 2, at Emeka, are vaccines from private sources safe? At Afolabi, is the federal government going to continue the COVID-19 relief payments? How do you react to these 3 tweets?
Okay, so thank you very much. COVID-19 variants are just a normal process which viruses undergo to produce different mutations. So the virus in itself keeps changing to have offsprings that are different from the parents. And it develops some structural changes on the virus that make it different in terms of adaptation to the body system and also in terms of recognition, by our immune system, such that the immune system will have to have a different mechanism to be able to recognize this variant. It is normal for viruses to undergo this variation, from time to time. Some of the variations may actually be good for us in the sense that the virus will be automatically killing itself. But some of these variations can be detrimental in the sense that it will make it difficult for the immune system to recognize it the way it used to recognize it. And also it can have effect on the vaccines that are already manufactured, so that vaccine that is working today will not be working when you have new variants that have developed. So in simple terms, this is what variants are. It's a normal process for the viruses to continue to undergo this transformation, but we have to live up to the task to make sure that we deal with the various variants as they arise. Second, test positivity rate just simply means that out of the total number of cases that you have tested, how many did you find positive? Okay. And we do that on a weekly basis, on a monthly basis, on and on, to see how it is changing over time. So as Dr. Chungwe mentioned, the positivity rate has actually dropped. It used to be around 1.8, it dropped down to 1.3, now it is less than 1%. So showing that, at least based on this testing that we are doing, the positivity rate is going down. Okay. Now, additional information here is that the total number of samples we are testing, and that's why Dr. Chungwe talked about the ownership and also taking responsibility by the states. The truth is that our states are not testing enough samples, because the NCDC has a case definition, which includes fever, cough, contact with person, and whatever. People have malaria all day. Are there samples taken to be tested if it is COVID? A lot of them don't get tested. So we are not testing enough. We have to test more in order for us to be able to pick any change that happens in the community. Then your next question is...
Is the federal government going to continue the COVID-19 relief payments?
So the relief payments are interim measures, and most of those, the relief payment was initiated during the lockdown, because we were aware, of the hardship, the difficulty that small businesses or individuals that have to live on daily bread, have to face. Because their businesses are closed, they cannot go out and make earnings. And that was why the government came out with this policy to ensure that they support individuals, we support families, and even some small businesses received some loans as a relief, for COVID-19. So I'm afraid it's not going to continue because it was a stopgap measure that was put in place to address an issue.
The next line of tweets, let's take them to Dr. Chinwe. They are related to what NCDC is doing right now. At Buba, now that vaccines are available, are Nigerians in the rural areas able to access them? Remember you told us about your centers in 774 government areas. And at Uwa, how can communities work together to overcome the shortage of testing kits and PPEs? And the last one here says, at Deborah, why does Lagos have the maximum number of cases and deaths?
So these are very important questions. For the first one, I think it's good that it's National Primary Healthcare Development Agency that is leading on vaccination, COVID-19 vaccination, because of their grassroots involvement. They are everywhere, and that's the primary healthcare is the basic unit of care that you have, and they are found everywhere, including in rural areas. So remember the first consignment we got, because it was just 4 million. So the idea was to prioritize those at high risk. Initially we had just for frontline workers and then those with comorbidities, but eventually it was expanded, especially because of all these myths that was just making people not to take the vaccine. So rather than waste the vaccine, it was opened up, and a lot of people, including children 80 years and above, can now take the vaccine. And let me just say here, maybe because NPHCDA is not around, I was in a meeting where they said that this week is the last week for the first dose. For those that want to get the first dose, they should quickly try and get vaccinated this week, or else the first dose will not be taken anymore, because they have to use the remaining vaccines as second dose for those that had received the first dose. Then the second question was about, sorry, can I get that?
Second question, it says, how can communities work together to overcome the shortage of testing kits and PPEs?
I like this idea of communities working together. That is an excellent question, because this is actually what we want to achieve, where everybody, you do not look at it as it is NCDC that should bring kits, it is only the government that can do this, but we're not asking the question, how can we support? How can we promote? And I think there's a lot of collaboration with this outbreak for the testing kits. I'm happy that currently we are rolling out the rapid diagnostic test kits, which are more readily accessible, and point-of-care diagnosis can now be made, even though it has its own limitation as RDT, but at least it can give us a approximate idea of the number of cases that we have, and it can enable early detection of cases anywhere in the country. So currently we are rolling it out in health facilities, building capacity, training healthcare workers on how to make use of these RDTs. So I think that is one key area that can help us to overcome this problem of lack of diagnosis. But we also have the PCR labs in all the country, and all the states in the country, and they are testing. We don't have issues with shortage of kits currently, so they are carrying out this test. For the RDTs, anyone that tests positive, we have to confirm with PCR, you understand. But currently, I think it's good we are rolling out these RDTs. It's helping to address the issue of testing in the country.
Before we take the last tweets, let's take our first caller tonight. I hear Yinka. Hello, Yinka.
I'm calling from Ibadan.
Ibadan, sorry, please. You're welcome to Tuesday Live.
Okay. I have a question for the MCDC people.
Go ahead, please.
Last week, 2 weeks ago, I registered to get vaccinated on the website.
Go ahead, please. Go ahead, Yinka.
Okay, I registered to get vaccinated. So I was sent a unique verification code. I chose an health center to get vaccinated. I love the initiative. And then I got the SMS, and I was told to confirm the SMS to let me know the appointment date. Up to now, I was unable to do that on the website. While this program started, I even tried logging onto the Federal Ministry of Health website to access to see how I can do this again. It's not going through. So when we talk about issue of people not wanting to take the vaccine, there are people that want to take the vaccine. But the process is not just available to us.
Okay. How do you react to Yinka's query?
Okay, thank you.
Or inquest?
Yes, for your question. Actually, it's the National Primary Healthcare Development Agency that is responsible for vaccination and registering people. But I'm aware that there was a time there were challenges because this thing is technology, and the way they mitigated it is that anybody that gets to the vaccination site is registered at that site before vaccination. I know I took my daughter and my driver yesterday for vaccination, and it was at that spot they were registered. So I don't think that should be a problem. Like I said, they have just this week. So I will advise you, Yinka, go to any of those vaccination sites. I believe that once you get there, you will be registered and you'll be vaccinated.
Okay. Before we lose Dr. Agwale again, his signal is up. Okay. I'll come back to you on the last tweet, which talked about the high number of from Lagos State. Yeah. And before we do that, let's take this caller again. Roslyn is calling from Abuja. Hello, Roslyn.
Hello, good evening, sir.
Good evening.
I have just 2 questions to ask.
Go ahead.
One of the questions is, if you've taken your vaccine, the COVID-19 vaccine, why do I need to do a PCR test if I have to travel for international? And then the second question is, why is the COVID-19 test being done in private hospitals and not government hospitals? Thank you, sir.
Okay. Maybe I'll allow you to respond to that.
Okay, thank you very much.
Okay.
For that question. So the first one is regarding the vaccination. Why do you need to do a PCR test when you have taken your vaccination? So the thing is, there are regulations. And we know that this vaccine, has efficacy of maybe about 90% at the best. For Oxford AstraZeneca, you take the first jab, it will just be under 70%. So what that means is that you can still be vaccinated and you can still turn out to have the infection, to even have severe infection. So that means that about 30% of people who even have the vaccination can come down with moderate to severe infection. And you can, of course, transmit the infection. So the thing is, it is better you have your 2 doses so that you have the maximum efficacy. But even after the maximum efficacy, which is about 90-95%, there is still that 5% chance that the vaccine will not work for you. And that is why you need to get tested and you need to show your result when you are traveling. And when you're doing international travel, it's a regulation by the other country, not by Nigeria that you are living, but by the country that is receiving you. If they say they need a PCR test result, you have to provide PCR test result. Then the second question, which is about...
The second question is about traveling.
Yeah, traveling is just what I explained.
Yeah, you have taken your vaccine, maybe 2 doses, and you want to travel. They still insist that you have answered that.
That is just what I explained. But there is still a second question. Do you remember?
No, you have addressed it too.
Okay.
You have addressed it already.
All right.
Okay, let's go to Dr. Agwale. Sorry, we had to discontinue with your line of thought because your signals dropped. I hear you're up now. But before you continue, just this question, I react to this before you continue, Dr. Agwale. Davis says, what is the expiry date of the vaccines in Nigeria? That's the question. You're coming from Maryland. How do you react to that?
I don't have the file with me to see the expiration date, but the thing is that, AstraZeneca, which is being used in the country, if you believe the second dose by 12 weeks, you get better protection, and then the efficacy is about 82%. If you delay the second dose by 12 weeks, you get that efficacy. So I don't have the bar, because expiration date on the bar, so I don't have a bar here to tell you whether the vaccine has expired or not. The point I was trying to make was that all these things that we're talking about, until we have domestic vaccine manufacturing capability, we are wasting our time. And we have offered several times that we can make this happen. It's not rocket science. It's not easy. It's not a straightforward thing. It's not child's play, but we can make it happen. This is basically what we're doing. So what we have decided to do is to use, which is what everybody is using here, contract manufacturing. So we have identified a contract manufacturer here in the US that will produce a COVID vaccine, which should be ready by the end of the year for clinical trials. And once that is completed, then by next year we should be able to roll that out. Now, the vaccine we are making is unique in the sense that we are not only expressing the spike protein, which is what every vaccine that is existing today is using, but we are expressing other additional antigens which are pretty conserved. So we see that as probably the solution for all the variants that we are hearing about. Because if you want to continue to make vaccines that are variant dependent, then you have a long way to go. So that is the solution that we are bringing up for Nigeria and for the world. So all we are asking the Nigerian government to do is to support the initiative because we don't want a situation. Already we are being contacted by several countries to license the technologies that we have. I mean, we are Nigerians, from Nigeria, so Nigerians should take the credit. But again, we can't sit down and waste our time if somebody is not interested in what you are doing, and then there are other people that are interested in what you are doing. So we are we are open to discussions to see how we can solve this problem in Nigeria. We can make this happen. We can do it. We have the necessary platform to make this happen. But we need a discussion.
Thank you. Let's go to New Jersey, where Dr. John Toagbede is joining us also via Zoom. Dr. John, I want to put this tweet across to you because it relates to your tough. At NADOP WEAVE 77 says, how long after vaccination will I develop immunity to COVID-19? On the other hand, I think the different waves which the virus poses is no longer a threat to many Nigerians as the weight of insecurity does. First things first, God bless Nigeria. How do you react to this?
I'd like to thank that person for the question. The truth is this, these different vaccines have their own what I call latency, period. But on the average basis for the Moderna and the Pfizer vaccines, you are looking at anything up to 45 days after you have completed, the first and then the second doses. And this is really very important, and it goes to answer some of the questions that had been asked. Or people would be wondering that if I take the vaccine, will I still be infected? Let me make it very clear here. The fact that you have completed even the 2 doses of the vaccine does not prevent you from, getting, infected. That answers the question which Dr. Mukhtar was, answering. The vaccine actually gives you that a potency of the immune system so that even when the virus comes in, your body can handle it better. It will take you a shorter time to, respond, by your own immunity. So the fact that you have gotten the vaccines, it doesn't mean that your body has had gotten that steep block wall against, the virus. That's why it's still very careful that even after the vaccination, you got to be very, careful. The vaccines only protect you from getting down further the line of developing the severe form of the disease. And basically and essentially, that is what the memory bases are there for. It's just to give an analogy that the vaccine actually gives you the gun and then the bullets. That once the enemy comes in, you are able to shoot and then fight, better than you just had an empty, barrel of a gun. When the enemy comes in, he will just, crush it. There to the point. So it is very important. Back to the line here. That's why I've always talked about this three-pronged approach against this disease. We're looking at the non-pharmaceutical interventions. We're looking at, vaccinations, and then we're looking at immunomodulating or building our natural immune system. These three should and must go together. It puts you in a better position. Even what we're facing now, both Dr. Agwale and then Dr. Mutar, they're not giving us definite answers, and it is not their fault. In terms of when we actually expect the next batch of, vaccines in Nigeria, it's an unknown. Because of the various problems that have been discussed, most of these developed countries have actually overstocked, these vaccines. Even with our money, Nigeria is not able to go into the market and then purchase these vaccines. So let's fall back to the third arm of fighting and protecting ourselves against this disease by building our immune system. That is very critical. Then we can complement it with the vaccine, as well as non-pharmaceutical intervention of social distancing, as well as using of face masks, until we attain that herd immunity which Israel and even the United States, Israel has attained it. United States has vaccinated 60%. Britain has made down, the same thing. Countries like Australia and even places like Taiwan, they've attained. That's why they have opened up their economy and people are going to. But in Nigeria, this is my own advice too. As long as we not attain that herd immunity, we must adhere to these three, facets: vaccine, non-pharmaceutical intervention, and up-regulating or building our own immune system.
Here we have this caller from Port Harcourt, Agu. Hello, Agu.
Hello, good evening, sir.
Good evening. Go ahead, please.
Okay, my name is Agu Chuku, calling from Port Harcourt.
Agu, please go ahead.
Okay, the positivity of COVID-19 has drastically reduced. What is the rate of testing in all the states? Who informed that vaccines are preserved at a very low temperature? How is the approved temperature maintained throughout the lifespan of the vaccine, especially at the health centers? The staff at the health centers administering the vaccines, what is their level of training? Do you guarantee their efficiency? If 2% are vaccinated within 2 months, mathematically, in a year, 12% may be vaccinated, and it eventually takes 8 to 9 years to vaccinate the entire population. All other variants, death and birth, remaining stagnant. What will be the fate of the overgrown population? Finally, if the developed countries have bought the available vaccines for some years to come, when will Nigeria have adequate supply? Thank you. I remain Agu Echukwu.
Thank you very much, Agu from Port Harcourt. You want to react to that? Or we'll take it to Dr. Agwale?
Well, let me just answer a few of the questions. It's really loaded. So you ask first about the positivity rate and what is the rate of testing in various states. It's quite varying. Lagos has been testing the highest number, and as such, that is why Lagos is also having a higher positivity rate and having higher number of cases.
Okay.
A lot of the states, I will tell you about 24 states now, have not been testing at all in several weeks past. And that is why we say that even though the total number of tests that are done in the country may appear to be just slightly reducing, the real numbers from the various states, if you disaggregate by states, you realize that it's only a few states that are accounting for the large volume of the tests that have been taking place.
Okay.
So that is why we are calling on the states to take ownership and make sure that they test as many people who have these symptoms, who satisfy the case definition criteria as possible. Secondly, you mentioned about when is Nigeria going to get the vaccine if we continue in this trajectory of doing 1%, in 2 months. So
and it gives some very complex mathematical calculations there.
No, it's not. So that is assuming that the trend is going to continue at that phase.
Okay.
If we're able to offset it and get maybe 24 million doses, of the Johnson & Johnson that is being expected, that is going to change. But I get his point. Probably what he's saying is that the uptake of the vaccine is still not fast enough. Because considering a population of 2 million people, that need to be vaccinated, and within a period of, 2 months or more now, you have only 1.2 million people. So, and the first people who get to be vaccinated are people who are eager, who are willing, who actually want to get vaccinated. But up till now, we have not reached that 2 million mark. So his point is actually that there is vaccine hesitancy. That is true. And that is why we are working to make sure that we have risk communication, we counter all these false messages, and we also encourage people to take these vaccines when they become available. Let me quickly touch on, one of the callers that mentioned, I think she asked about why are we testing in private labs?
Yes, I said why testing in private
labs
instead of public?
Instead of public labs.
Yes.
So the thing is, because it is private, because it's usually for travel, it's for travel that we said people should go to private laboratories and do testing. That is because we cannot subsidize, for people who are traveling to make it free. These tests are very expensive. NCDC will tell you how much it costs to set up these laboratories, how much it costs to buy these reagents, and therefore it ought to be done, to be paid for. So we do not want to mix government services, which is free. If somebody now is detected to have temperature or to satisfy the criteria, he will be tested for free. Once you introduce commercial testing in the public laboratories, you are going to ruin the public side of testing, because naturally people would put more efforts and make sure that they do where monies are paid. And therefore we'll have backlog of samples for people who need to be tested, who have come into contact with COVID cases, or people who actually have the disease, are in recovery, and there will be those issues. That is why we divided it into two and said that the private labs should do the travel testing and the public labs should now do the testing for the general public.
Okay. When we come back after the reports, we take other tweets and other concerns before we wrap up the program tonight. Our next report coming from Delta.
There has been a downward curve in COVID-19 infection rates in Nigeria. However, the fear of the resurgence of the pandemic based on the new deadly variants in India, Turkey, Brazil, and other parts of the world has forced the Nigerian government to reimpose the already existing COVID-19 protocols. Unfortunately, Nigerians seem to have abandoned these preventive measures in crowded places like the markets. Some carry their face masks in their bags rather than wearing them.
I have my face mask with me, but it's just that I just ignore it because for a very long time now we've been putting on face masks and we are not seeing anything happening.
Online and offline. Compliance to the COVID-19 protocols vary from schools to schools depending on the level of enforcement.
Very many people are loose about it. That is wearing the face masks and maintaining social distancing, especially those in the social clubs and so on and so forth.
Members of the congregation, members of the religious faith and so on should maintain the protocol of the social distance, covering of the face mask and all of them that will not even cost us much to observe. You can see I'm wearing my own now.
Also urging the government that they should look for a task force that will come down to the markets so that they can be able to enforce it, so that people will start putting on their face mask, because it's very, very necessary, please.
We just have to continue to sustain the tempo, the decline. Now, the observance of what we call IPC, the Infected Prevention Control, and proper observance of the COVID-19 protocols, and then the vaccination.
There is also need to sustain the ongoing vaccination campaign and carry out more sensitization to reduce the incidence of hesitancy to the COVID-19 vaccine amongst Nigerians.
From Asaba, we go to Jos.
The massive turnout of people for vaccination against COVID-19 is an indication of acceptability.
I encourage people to do it because some of the complaints we hear in the social media, as I said, I have done it and I haven't experienced any of those complaints.
People should go for it. If our leaders can go for it and take it at will, even in the presence of everyone, then we should be rest assured that the vaccine is okay.
COVID-19 is real. We are not disputing that fact. But at least once you know what you need to do to help you prevent yourself.
However, with the third wave ravaging some countries, the Presidential Steering Committee reintroduced restrictions that were earlier relaxed.
We work in concern now with what the federal government is doing. So we take directives from them. The circular that is federal government brought, the National Steering Committee brought, we look at it and obey it strictly.
Nigerian government, in being proactive, that's why they reinstituted those measures and asking the public to cooperate to ensure that at least we survive the third wave. And of course, the vaccination that is ongoing, it's another process in ensuring that people are prevented from coming down with the COVID.
Acceptability, there is some level of hesitance, we all know, based on the information and various conspiracy theories that have been flying out there, fueled by social media, where you see information going out, misinformation as well going out to people, which cause a lot of reluctance and hesitance in people taking.
As report tonight is coming from Benin.
Has not relented in its efforts to contain the spread of the virus in the state. A number of safety guidelines issued by the federal government were recently reinforced by the Presidential Steering Committee on COVID-19. As a complement, the state has adopted other precautionary measures to tackle the spread of the virus, one of which is continued campaign and emphasis on the importance of upholding safety protocols at all times.
We have a biostatistician, consultant biostatistician, that is forecasting, giving us models to use. And really, since the first wave, all the models he has given us, if you do this, this is your risk. If you do this is your risk. Everything has been working in place.
In spite of these measures from both the state and federal government, many residents are still indifferent to the dangers of the virus and, unless when compelled, are reluctant to comply with the safety measures.
Wearing face mask is part of it. So, as a good citizen of Nigeria, we must put on face mask.
The same attitude tends to be in evidence with the ongoing COVID-19 vaccination exercise. Data obtained from the State Primary Healthcare Development Agency show that out of 81,080 doses of AstraZeneca vaccines allotted to the state in the first phase, only 36,689 eligible persons have so far been vaccinated.
We have vaccinated 36,689 eligible persons, of which 7,500 from healthcare workers, 10,949 for strategic leaders, and 18,240 for frontline workers.
The state is, however, applying new techniques to getting people vaccinated, including bringing the vaccines to their doorsteps.
We have been doing a lot of sensitization, both in the various community, through the RACECOM officers, like the educator, sensitizing a lot of people to get themselves vaccinated.
The state is also optimistic that more eligible persons will receive the vaccines before the commencement of the administration of the second dose in a few weeks' time.
Edo Benin is our last spot tonight, but before we take on Dr. Gwale and Dr. John Takwe, the issues here to be addressed by NCDC and the Presidential Steering Committee. Let's begin with NCDC. NCDC should tell us if they have confirmed the presence of the deadly variant ravaging India in Nigeria, and how widespread could the variant have penetrated the population. Second leg, NCDC says between 30 to 40,000 tests are carried out every week with positivity rate of less than 1%. Does this not imply that we need to do more to guard against importation through air and land borders?
Yes, very interesting questions again. For the first question, yes, the variant, the B1617 variant has been detected in the country, and it was announced by one of our partner scientists in Africa Center for Excellence, Center of Excellence for Genomics of Infectious Disease. But it was just just a few cases that were detected. In the country, we are still building our capacity and strengthening our genomic sequencing capacity. At NCDC, currently, we are sequencing samples, and we are growing in that capacity. That will enable us to carry out more of these genomic surveillance to know the kind of strains that are circulating in the country. The problem we should be seeking to address is how to keep ourselves from these strains, because it's the same non-pharmaceutical intervention that keeps you from one strain that will also keep you from the other. So it's not whether there is a variant in the country, but how the risk of that variant really spreading. And that was why this proactive measure was taken by the government to limit the spread of whatever virus, wherever it is, whatever strain. So that is for that. And then the second question, sorry if you don't
NCDC says between 30 to 40,000 tests are carried out every week with positivity rate of less than 1%. Does this not imply that there is need to do more to guard against importation through air and land borders?
Okay. That is also one of the interventions that have been put in place in this phase of restrictions that we talked about. So we've also scaled up surveillance at the ports of entry, and all the measures that we have put in place so that those who are coming in, especially from these countries like India, Turkey, and Brazil that have these Indian strains and have the severe forms of the outbreak, once they come into the country, they are expected to go on isolation in our isolation centers. So while all the other travelers that come into the country are advised, and it's recommended that they go on self-isolation for at least 7 days and then get tested to see. So these are all measures to help mitigate and limit the possibility of importing this virus from any of these countries where they are. These are the things that both NCDC and the Port Health Services of the Federal Ministry of Health is doing to ensure that we don't import these variants of concern into the country.
Okay, quickly, Dr. Mukhtar. The Presidential Steering Committee says at its briefing on May 10th that some foreigners evaded quarantine despite the recent restrictions and vowed that they must be penalized after investigations. How long will such investigations take, and what will be the penalties? Will there also be contact tracing?
So certainly, we have taken these measures. There are certainly Indians that have evaded quarantine. We have contact traced their addresses, and we are working.
They're in the country here?
Yes. So certainly, violating the protocol is taken very seriously. If you are a Nigerian and you refuse to go into mandatory quarantine, we are going to take very severe measures. Your passport is going to be suspended indefinitely. We've already secured that approval from the Nigeria Immigration Service, and you will be required to, do that mandatory quarantine and then tested and be prosecuted afterwards. You will be liable to jail term or to fine and imprisonment. The Infectious Disease Act is very clear. The Quarantine Act is also very clear. The presidential, directive on health protection is also very clear about that. We just had a meeting with the Lagos State government, and Lagos is pushing ahead to declare these people wanted and to bring them to justice. Certainly, there has to be deterrence. We cannot put in regulations. When Nigerians go abroad, you find out Nigerians are one of the most obedient people, following the regulations of other countries. But once they arrive in country, they begin to flex and then try to disobey the rules. So certainly, we are not going to take it lightly. We have to really take serious action, and we are taking it, and we'll make sure that these people are brought back and they have justice.
Okay, thank you. Let's quickly go to Maryland. Dr. Ogwale, just a few seconds. We don't have all the time while we're about to complete the program. Well, what hope for Nigeria?
Like they said, we need to know that the Indian variant is probably the fastest spreading mutant on the planet. And the fact that it has been reported already in Nigerian means that in the absence of vaccines, we have to revert to the non-pharmaceutical intervention because this particular variant has more than a dozen mutations. And then recently, the data which is going to be published very soon shows that it has about 7-fold reduction in against the current vaccines that we have. That is the Moderna and the Pfizer. So it's a problem. So the solution that this thing is that we need to build our own local manufacturing capabilities, which is doable, which you have the expertise in the country. I mean, Nigeria is one of the blessed countries in Africa to make this happen. But government has to be interested in this and then discuss. There are a lot of other countries. I mean, Rwanda president went to EU, got all the support and all of that. But you need the expertise to make it happen. Nigeria has the expertise, but where's the political will? So this is what we need to discuss. So I think my advice would be that let's focus on building our own local manufacturing capability. Without that, all we are talking is basically a waste of time.
Dr. Simon Agwale, he joined us via Zoom in Maryland, United States. Thank you so much for being on the program tonight. And if Dr. John Toagbide is listening, please, just a few seconds. We're about to round off the program. What hope for Nigeria? A few seconds, please.
I got some, well, number one point, let me just clarify the myth. Let's really very be careful about, the myth, what goes on discouraging people. People should be very careful. Everything is actually based on data. And Hausa people say that gafili gadoki, which means that you have a horse, that then there's a ground to test it. I actually tested myself whether this myth about the vaccination sites actually would magnetize a coin. For example, it didn't work. The second appeal I would also like to make is to appeal to the federal government and even our own scientists. The federal government, the appeal should come to the point of it that we should encourage our own. Nobody is going to do it for us. We've got to do it for ourselves. So our own that are in the forefront of this vaccine manufacturing should be, encouraged. Then, and then those of us who are also on the forefront, we should never be discouraged. There is no easy path for good success. There are challenges. We should be encouraged. Then, thirdly, we should look at ultimately building our own vaccines manufacturing site. That will be the ultimate solution. And my watchword is we should build our own immune system too. There are several ways. This has been my message, and I will continue to emphasize our natural immune system can be up-regulated or immunomodulated. Thank you.
So John Tor Aguide, he joined us via Zoom in New Jersey, United States of America. And back here, we don't have the time. Dr. Chinwe Ochu, it was nice having you on the program tonight.
Thank you.
And Dr. Mukhtar Muhammad, Technical Head, Presidential Committee on COVID-19 and National Incident Manager. We believe we'll have you one more time and one more time again before the end of maybe the next variant.
It's my pleasure.
Well, that's it on the program tonight. The message is take responsibility, and the rest is known. Thank you for your tweets and thanks for your phone calls. Don't forget to support the NTA in the fight against rape and rapists. To be a star.